Hi everyone. Apologies for the delay. Ella's off and I couldn't get into I had a bit of fun and games getting into the Zoom because it's all under Ella's uh, sign on. So thank you all for joining. Um, and we've got a really nice agenda for today. Georgina Carr from the Neurological Alliance is joining us here. And that's our main event for today. Georgina is going to present us some of the initial results from my neuro survey on the epilepsies, so that we can see what kind of data we might be able to use um, ongoing for our future work. And I know I've got a slide, and if Felix can join us, he will quickly present at the end an opportunity for us. But if not, I've got a slide from him that I can share some info with you all. And I think, Claire, you also had a little bit of info for us as well. So lots to cram in. So not good starting a few minutes late. So I'm going to say over to you.
Green, if that's possible. The easiest way just to look at the contents, I think. Okie dokie. So at the last meeting, I mentioned we're about to publish our transition guide. It's available on our website as a download, and I'll send you the link. So it's in two parts. The first is really kind of each element that's involved in transition and what's required for that. So there's the legal impact. So there's a little bit of intro from us. Understanding the legal impact. So there's something about mental capacity, and because we've written it for Dravet Syndrome UK, the majority of the adults, young people won't have full capacity. Some will have partial capacities, but we explain all the elements of that. Then there's a section on moving from child to adult healthcare services. And, we all know this is really difficult because pediatric, you've got everything there, you've got a big team. And, it can be a little bit like falling off the proverbial cliff going into adult services. So this section is a little bit about explaining what your medical team might look like, some tips, and things like, for example, sorry, that's my dog barking, that a hospital passport is useful. Then we've got a section on the social care aspect of things. Again, lots of detail about the Care Act. Then a little bit about EHCPs, how they continue or not, NHS continuing healthcare, funding packages, what happens if they're refused. Then we've got a little bit about learning options, financial supports, an advocate. That's part one. And then part two is more about the impact on family life. So a little bit about supporting siblings. It's like periods, emergent sexual behavior, not really talked about very much, but it is an issue. How to keep your young person safe, contraception and pregnancy, and then just some links. So that's a whistle stop tour. Obviously, it's all very much branded to us. It's a lot of pictures of Dravet syndrome. So my question is really, we know that a lot of this is relevant for everyone here. Transition is really difficult. So whilst it's been a big investment for us, it was well over a year in the making, lots of expertise has gone into it. So we would need to retain the authorship, but, happy to remove the overt branding, the specific references to Dravet syndrome. So what I was going to say is, if you could, I'll share the link after this meeting, have a look at this bit here. I'd love your feedback on what would be helpful, and we can look at making a simplified version of the core content available. because as I say, it's kind of, we want to share, we obviously need to retain some of the work we've put into it, but I'm sure there's a good balance that we can come to that's helpful for everyone. So yeah, that was my little update. I don't know if anyone's got any questions, or if Georgina, you're ready to go.
I am, but please go ahead with the Q&A.
Yeah, Catherine, go on.
Thanks. Hi, Catherine from Young Epilepsy. That looks really great, that transition guide. You say it's new, Claire, that new one from you guys.
Yeah, we had one previously. This is our old one you might have seen. So this was fine, but it was a very top line one. What we've done with the new guide is expand it, bring it up to date, but put a lot more practical tips in it. Sort of take, okay, this is the top, but what do you really need to know? And also, you know, a lot of links and signposting, but also experience of other families.
That's great, thank you. And how much of the content is specific to Dravet syndrome? So when you're looking at, I suppose, that wider benefit that I know lots of other families will get that don't have Dravet syndrome, what's the sense there?
It's difficult to say exactly. I mean, it's written with Dravet in mind, which is to say, you know, quite, you know, assuming that someone's got quite a severe epilepsy,
Yeah.
and also that we're really speaking to the parents rather than the adult or young person themselves. So it kind of assumes that they've got partial or no capacity. But I think, you know, the part one in particular is probably the most broadly relevant. I think things like, you know, the summary of the legal guide, the changes that you can expect when you're going from pediatric to medical services, that first section to me is probably the most relevant, and could probably be, you know, adapted most easily. So yeah, that's my thoughts. But you know, I'm an expert in Dravet. I'm not necessarily an expert in anything else. So definitely appreciate everyone's thoughts on that.
That's great, thank you. Yeah, because obviously transition for these young people, as you say, is even more complicated, and for probably all of the families represented by this membership, isn't it? So I'm sure it's really helpful. Thanks.
Yeah, I can see a lot of immediate relevant sort of things jumping out. I think would be to a lot. So you'd like us all to sort of feedback to you and say, you know, which sections. Great. No, I think that would be super if we could create a generic rare epilepsies, as in complex, rare and complex, the severe epilepsies, simplified or generic. I think that would be a fabulous resource. Thank you so much for sharing.
No, my pleasure. I hope it's helpful. I know it's such a tricky time for everybody. So and we're really proud of the guide and think it is useful. So if we can make that more available to more people, then you know that's we're very happy to do that.
Brilliant. Thanks so much for sharing. So if Georgina, you're ready, because I'm conscious you're on a timeline as well, I'll hand back to you.
Thank you. So really sorry about that. Not entirely sure what happened. Great. So moving on, just still on the adult survey here. So we asked firstly about people's experiences of different symptoms and health issues more broadly, and they were asked to kind of rate the impact on a scale from very much to not at all. So the dark purple bit at the top, where hopefully you can see the figures, that is where people have rated that symptom as impacting them very much. So 33% of people affected by epilepsy that responded to the survey told us that thinking and memory impacted them very much, and a further 24% of people said quite a lot. 32% of people said seizures impact them very much, and 23% said quite a lot. 27% of people reported sleep as being impacted very much. and a further 21% people said quite a lot. And consistent with the broader survey, fatigue was very highly impactful as well. So 29% of people said that that impacted them very much, and a further 24% of people said quite a lot. And on the right there, there's some experiences shared from people that responded to the survey, talking about the kind of impacts of those different symptoms on their day-to-day life. We also asked about the impact of living with a neurological condition on their wider life. So a similar sort of theme here. So the dark purple here is where people say that it's been, that aspect has been impacted very much. So 36% of people with epilepsy that responded to the survey told us that work or studying were impacted very much. 26% of people said the same about being active. 23% of people said socializing and doing fun things out and about were both impacted very much. 19% of people said that their ability to manage financially was impacted very much. And a further 10% of people said that this was impacted quite a lot. That's pretty significant, I think, in the current climate, bearing in mind as well that there's going to be further restrictions, most likely on support to deal with the extra costs of living with a neurological condition. And this survey, of course, was done the back end of last year. So this is likely to have got a little bit worse. We also looked at the impact of living with a neurological condition on mood and mental health. And similar to previous surveys, lots of people telling us that they either live with a mental health condition in addition to their neurological condition, but also lots of people reporting that they don't get the support they need to maintain both mental well-being and mental health. So 43% of people that responded to the survey living with epilepsy said they lived with a mental health condition in addition to their neurological condition. 36%, oh, sorry, the numbers are wrong on this, but 36% of people did indeed disagree that they had somebody to talk to about their neurological condition. And 31% of people disagree that care for mental health services meets their needs. We also asked them about their experiences of the health system more broadly. And again, we asked people a series of statements and asked them to tell us the extent to which they agreed or disagreed with those statements. So 12% of people living with epilepsy that responded to the survey said that they strongly disagreed with the statement, "I can afford the additional costs associated with treatments for my condition." 16% of people disagreed with that statement. 10% of people strongly disagreed that they had access to reliable transport to attend appointments, and 17% of people disagreed with that statement. 7% of people strongly disagreed that they can schedule appointments without conflicts with other commitments, and 19% of people disagreed with that statement. 13% of people strongly disagreed with the statement that they have someone to talk to about their mental health and well-being, and 7% of people strongly disagreed with the statement they feel involved in decisions about their treatment care and support plan. We also provided a list of services that people may wish to access, or indeed may kind of report that they're not relevant to them. It was quite a detailed list following input from across our membership to develop the service list in particular. But nonetheless, we did find really high levels of unmet need across the population, including within people affected by epilepsy that responded to the survey. So of those that felt neuropsychiatry was relevant to them, 56% of people said that they hadn't been able to access that as a service. 52% of people affected by epilepsy that felt a dietitian would be beneficial hadn't been able to access that service. 47% of people said the same about pain services and community transport. 46% of people said the same about respite care, and 45% of people said the same about accessing supported living and residential care. I should say this differs very slightly from the wider survey results. For example, neuropsychology, there was quite a high unmet need across the all people that responded to the survey around this. But nonetheless, as you've seen, there's really clear impacts on people's mental health that are being reported. Now to move on to the carers survey. Because of the numbers involved here, I've focused on all carers rather than those just responding to that support people living with epilepsy, but very happy to have a close look at that data if that's useful. So more broadly, we received more than 1,200 responses for the carers survey. And again, we're really pleased with that because it's the first time that we've done it. 15% of people said that they supported more than one person living with a neurological condition. 47% reported that they were a spouse or partner. 37% were a parent or guardian, and 9% of people were a child of a person living with a neurological condition. Just under half had been caring for between 1 to 5 years, but 29% of people had been caring for over a decade. We again saw a high proportion of females respond to this survey than males. And again, we were disappointed with the ethnic and racial diversity response rate for this, with 95% of people reporting as British white. We looked at the types of care that people were reporting. 94% of people said that they provided emotional care for people affected by a neurological condition. 79% of people said physical care, and 73% of people said financial care. We also asked people to say, to comment on how independent they felt that the person they cared for is in their daily activities. And nearly half of people said that they were caring for somebody that wasn't independent, i.e. needed assistance with most or all of daily activities. 32% of people said somewhat independent, i.e. requires regular assistance with daily tasks, but can perform, stop there. This is perhaps one of the more stark findings, but unfortunately not surprising. 52% of people told us that they cared for 50 or more hours per week for a person living with a neurological condition. And a further 13% of people said that they cared for between 35 to 49 hours per week. So taken together, that means that 2/3 of people that responded to the survey spend more hours caring than they would on a potentially on a full-time job. And on the quote there on the right, you can see the very real impacts of caring on somebody's identity and wider connections with people. At the same time, we heard from lots of people that just didn't feel supported at all in their role as a carer. So again, on the right, you've got quotes from the respondents telling us that they feel isolated in the caring role, particularly from those that were living with more rare conditions, or supporting people, sorry, living with more rare conditions. And lots of people simply saying what support, because they just don't get the support that they should be getting, or aren't what that they should be getting. So again, we asked people to tell us the extent to which they agreed or disagreed with a variety of statements. 19% of people strongly disagreed that they feel supported in their caring role, and a further 31% of people disagreed with that statement. 7% of people said they strongly disagreed with the statement, "I'm able to manage my own health and well-being," and 22% of people disagreed with that statement. 5% of people strongly disagreed with the statement, "I'm able to manage my own day-to-day needs," and 19% of people just disagreed with that statement. So again, clearly significant levels of unmet need amongst people affected by neurological conditions. And then finally, we conducted a children and young people survey. The numbers with this really were low. We changed the methodology slightly from the last time that we did it. We tried to make it more accessible to children and young people to respond themselves to the survey rather than somebody on behalf of somebody else. So what we did actually do was increase the numbers of people that of children and young people that responded themselves. We did have a high proportion of people affected by epilepsy, children and young people that responded themselves, as you can see there. So 95 people affected by epilepsy responded to the survey directly, 19 of which reported living with more than one neurological condition. and autism and hydrocephalus were the most common reported conditions in addition to epilepsy. As you can see on the right there, in terms of gender split, we had a bit more of an even split across male and female. There were options to put prefer not to say, but people didn't take those up. 53% of respondents were aged between 14 to 17. So again, we asked people about the ways in which their neurological condition affects them. Nearly 3/4 of people told us that how they think and learn were impacted by living with epilepsy. 53% of people said the same about sleep and mood, and nearly 1/3 said how they move, like their movement was impacted by living with epilepsy. Again, we looked at the wider impacts of living with a neurological condition. Nearly 1/4 of people said that keeping up with their daily routine was impacted by epilepsy. 21% of people said doing fun things out and about were impacted, and 16% of people said paying attention, i.e. staying focused, was impacted by living with epilepsy. We then asked children and young people to tell us how their health makes them feel. 53% of people said it made them feel frustrated and angry, and 58% of people said it made them feel worried or stressed. Similar to the results I just showed you around kind of socializing and relationships and so on, 37% of people said that they feel left out and that they're missing things. But we also heard from people that said that, 1 in 5 of people affected by epilepsy said that they're proud of themselves for how they handle living with the neurological condition, and 1 in 10 said that they were happy, that they were unique. We also asked people about what support they're able to access. 1/3 of people said that they received support from school for their schoolwork. But really worryingly, 1/4 of people that responded said that they don't receive any support at all. And linking to the conversation that you were just having around transition between from children's to adult care, really significant levels of people just not receiving any sort of detailed information about that transition. So 63% of people told us that they hadn't received any information at all about transition from paediatric to adult care. 11% of people on top of that said they'd like to know more, and another 11% said that they wouldn't know where to get that information from. Of those that said, yes, I have received information, just 6% of people had told us that they had a dedicated worker to support with that transition between paediatric and adult care, which is really worrying for lots of reasons, but not least of all because within NICE guidance, every person that's going through the transition should have a named worker for that process. So just look at time. So we've got a little bit of time for discussion, which would be good. But just to say to the next steps, we're currently going through kind of a co-design process with people affected by neurological conditions to look at the public policy recommendations for the campaign launch. We'll be going to look public with them in June, from the 18th of June. And we're also looking at developing an integrated care system data tool in England for the adult survey specifically, because we have data to break that down to ICS level, which hopefully is going to be really helpful in the current commissioning climate. I really appreciate any reflections or questions that you've got, any results that might have surprised you or not, or any suggestions as to kind of public policy changes or practice that you'd like to see as a result of this, or indeed your other thoughts that you have on it. The final thing to say is, just because I was worried about time, was we do also have results from carers on behalf of children and young people living with neurological condition. I just haven't presented them today, but again, I'm really happy to provide those to members of the coalition if that's useful. So I'll stop there, but thanks again.
Thanks so much, Georgina. I think that was, really interesting, and thank you for presenting that. Will you be able to share with us the slides, or do you want us to wait for the formal results and you'll share those for
That's fine.
so we can
No,
start using them?
That's absolutely fine. Just ask you that you use them internally for the moment, and then feel free to use them externally from the 19th of June, which is by which point we'll have published, if that's okay.
That sounds really reasonable. Thank you so much. Any thoughts from anybody, immediate reactions to that for Georgina, the group?
I think it goes without saying it's a great bit of work, and it'll be really useful, I think, moving forward to produce a campaign for it. It's really hard evidence, and it's excellent.
It'll be really nice, I think, to see how we can link this and tie this in actually with the solutions table that we're working on writing up at the moment, and kind of to see whether those numbers reinforce the challenges that were reported by the patient group leaders here, and that will strengthen our argument, I think. So that could be really powerful. I think Catherine might be next, and then Claire.
I think it was Claire first.
Oh, which way round?
Yeah, you go first. It's fine.
Oh, sorry. Yeah, I'm off mute. I agree with you. That statistic, 6% have a named worker, is absolutely shocking, isn't it? My question though was about the diversity, because we struggle as well. It's something that we try and do, be more representative. Do you have any insights on what the barriers might be to that, and what you might do differently to try and get that sort of broader mix of people, global majority backgrounds, for example?
Yeah, so I think it's unfortunately a shared challenge really across the sector. In terms of the barriers, I do think promotion methods has got something to do with it. So it's primarily through our membership, and it's primarily through clinics. And it's so I guess barriers to, for example, access to specialist care are unfortunately alive and well, and do disproportionately impact certain communities. So I think that's got something to do with it. In terms of how we might address it in the future, so we'll definitely do things like maintain the language line. So, language isn't a barrier. We'll do things like the telephone line more broadly, for sure. And we're trying to develop kind of partnerships with more community-led groups. So really, to be honest, looking outside of the neuro sector, but kind of faith-led groups and so on. But that takes time. And it's a relationship based on trust, and that takes time as well. So we need a good lead in time, and we're not the only ones. It's not a neuro specific thing either. So it's just something we're doing, things like working with national voices who have a good link in with different groups and so on. So we're trying lots of different avenues, but it's not going to be a quick fix. So that work for the next surveys, happening now essentially.
Oh, interesting. Thank you for sharing.
I was just going to ask about a little bit about the data related to children. So like you were saying, how you've got the data from the Children and Young People Survey, and the data related to carers of children. Because I imagine because at the moment, from what I can see, it looks as though you've got the adult carers of adults and carers of children together. So will you be teasing those apart in like the analysis? I'm just thinking in terms of obviously how do you distinguish between routine care of a child and additional care responsibilities, or is this is not possible because the nature of the question?
I mean, it's difficult because of the nature of what we're asking, but also just that, you know, it's difficult, I think, to distinguish between those things in your daily life, perhaps as well. So yes, we will look at differences reported from people supporting adults living with a neurological condition versus children and young people. There is a cohort of people that are who are supporting more than one person. So there are some people, for example, that are supporting their parents as well as their child living with a neurological condition. So there are some complexities to that. Because of the numbers involved as well, condition-specific data is quite tricky because we risk breaching anonymity. So it's, for most people, we'll be looking at kind of pan-neurological data. But nonetheless, we can certainly look at, as I say, differences reported by age and person, age of person. Care for. Yeah.
So looking at all parents, or looking at carers of all neurological conditions, like that. And then in terms of the campaign asks, it sounds as though they might be more focused on adult neurology generally. Is that right?
So, no, I think we're really interested in kind of public policy solutions specific for children and young people services and practice as well. Because we've got a bigger kind of set of data, you know, we can do a little bit more with the adult survey. But we've also got a huge amount of data to go at, and so our current thinking is that one big splash in June is probably not going to do justice to the huge variety of experiences that have been reported through this. So what we'd like to do is a bespoke briefing looking at children and young people's experiences only, and in that we'll do a deeper dive into public policy and practice for sure. We did that last time and it worked pretty well, and also we can do things like, you know, work more closely with BPNA and others to develop some of those recommendations. And of course, the experiences of children and young people are unique as well in many cases. So you know, we need to think about that in a really careful way. But so yeah, all that is to say, we're launching in June, but we want it to have kind of a long tail, I suppose. So we look at different communities within the data that we've been able to collect across the different surveys.
Great, thank you. Would there be a way for me to be like to catch up with you guys about that before it's launched? Unfortunately, the membership fee for us is prohibitive, so we're not part of the Neurological Alliance. But I'd be interested in finding out about what, particularly around the messaging for children, just if there's anything that we can share, I guess, from the work that we've been doing in pediatric epilepsy, and also just to find out about your plans would be really helpful.
Yeah, very happy to catch up on that. Yeah.
Great, thank you.
Can I just briefly ask Georgina, I know there was quite a small sort of number of people that reported that they had a rare epilepsy. Was it possible to look at if there were any significant differences in the sorts of results that were shared by people with epilepsy generally to the sort of the people that actually said they had a rare epilepsy? Obviously, we don't know if people with epilepsy didn't report whether they had a rare epilepsy or not, but just wondered if there was anything that jumped out as any particularly different, or was it just following a very similar trend?
So it is following a similar trend. Again, didn't present it today, and the numbers are really small, but we can do things like group rare epilepsies, for example, together versus either the kind of survey cohort more broadly, or versus people that reported as epilepsy only, depending on what you think would be most useful. But by and large, there's quite similar trends being reported. But yeah, happy to do that.
Yeah, just be very interesting. Anybody else got any questions for Georgina? Because I know she has to dash off and jump on a train, I believe. Okay, can't see anything for anyone. So thank you so much for sharing that with us. I think this will be really powerful. You know, for us, as well as to get behind and put our voices behind your campaign as well. So yeah, thank you so much for sharing, and yeah, let's see what we can do to make some noise about neurological conditions and make things better. Thanks, Georgina, for joining us.
Thanks, everyone. See you soon. Bye.
Cheers. So I'm really pleased to say that Felix has very timely been able to just join us. Hi, Felix.
Hi, Alison. Hello, everyone. Nice to see everyone.
Great. So Felix has just jumped off another meeting and just joining us for the last few minutes because he's got a really exciting opportunity to share with you all. Do you want me to share your slide and then you can talk through it,
Yes.
Felix?
Yeah, yes, please,
Let
Alison. That
me
would be
do
great.
that for you. Okie dokie. Here we go. Over to you, Felix.
Great. Hello. Hi, everyone. So I believe I've met most of you, but for those who I haven't met, pleasure to make your acquaintance. So my name is Felix Chan. I am currently a researcher here at the University of Birmingham, but I work closely with Alison and UKRET and rare epilepsy. And we have a great opportunity coming up, a save the date that I would like to spread to the UKRET member. So we call this study the Persona Day. It's essentially a PPIE workshop, so patient public involvement and engagement workshop, where we want to get your input as a member of the UKRET community that represent patients with rare epilepsy on a study that we would like to design called the Persona Study. So the aim of the Persona study is to measure sleep and body rhythm changes in patients with epilepsy. So it will involve various different instruments and kits. So we would like to get your input on those kits, the logistics of the data collection, and any issue or concern that may affect the study that we haven't thought of previously. So it's a half-day PPIE workshop based at University of Birmingham to be held on the 1st of July from 10 a.m. to 3 p.m. That's our tentative schedule for now, but this may change. There is, oh,
Did we just lose Felix? Oh, he's still there in the background, so let's hope he can join us back in a moment. So does anybody sort of off the top of their head, I think we did put out a save the date, but I don't know if some of you saw that back on a previous newsletter that Ella issued. I think this would be a really nice opportunity, not only for the study that Felix is doing, but also for some of the UKRET members to be able to come together as well. We are still trying to work on a meeting, and we were trying to see whether we might extend Felix's meeting while some of us are already there, and take that as an opportunity to stay for an extra couple of hours for those that have travelled, to have a bit of a UKRET in-person meeting. Anybody thinking that might be something they might want to attend or be able to attend, or conversely not able to attend? Oh, I can see Sophie's got a clash. That's a shame.
Can we send a family on our behalf?
I would think so, yeah. I mean, Felix has got on there that, yeah, someone with lived experience. So I would think, yeah, absolutely. If you're the main person, but you can send somebody else who can represent your community and, yeah, the experience, I would have thought that would be okay. We can check with Felix, but.
Alrighty. Can I have a copy of this to be able to send them? Is that right?
Yeah. I And what I know from Felix is the official invite, he's just waiting for the final ethics approval, rubber stamp, and then he can send official invites and so on and so forth. But that's all in train. So we're just hoping that that's just a formality, and as soon as we've got that, any further information we can send through. I think he's looking for quite a few of the different conditions to be represented here. So it'd be really nice for as many that are able to make that meeting. It's an expenses paid meeting, so your travel, etc., will be covered by the project, which is nice. Mel saying, yep, you'd like to be there, that'd be good. Obviously we'll share with anybody else who's not able to join this call today. So yeah, obviously we'll share all of this round. Doesn't look like we're going to get Felix back, which is a bit of a shame. One very last thing before we all disappear that I just remembered that I ought to share with you. So Claire and some of the team at Drave and some of the others have been, here comes Felix. I just want to quickly share with you. They were working on some social media graphics and posts that we can put together for our to share the leave piece from the challenges roundtable that we did. And I can just very quickly show you on a share screen some of the graphics that the guys have put together. And I hope you can see these. They've put some together on Canva, some really nice imagery for us to share, where we can put our own logos onto the imageries if we can share these through the Canva link. And they've also put together a really helpful little short Word document with some suggested wording for posting and how we can share these different imageries. So sort of, drip feed them out, one a week or one every couple of weeks or something, with some messaging around, the work that we've been doing and the important findings and challenges. And there's a graphic on the diagnosis piece, the treatment piece, and the coordination of care piece here as well. So we will share this out, but I just briefly wanted to share with everybody that this is coming, and we'll be sending this out to everybody. And we'll try and make a very coordinated approach to sharing through social media with a hashtag and everything, so that we can really try and make some noise about the work that we've all done together on that. So that's all coming soon. Okay, Felix, are you back with
No,
us?
Sorry, I had an issue with battery on my computer, but I know it's time approaching 1:30, but I'm happy to take any questions from anyone. But really, the message is to save the date, because I would love to see the majority of the UKRET people there. We have funding to support up to 20 patient charity to attend, and we would like one representative from each patient charity with lived experience. So for charity with leadership that does not have lived experience, the leadership team are also welcome to attend, but I'm afraid I will have to be out of their own expense, because we don't have fund to support more than one representative per patient charity.
Does anybody have any quick questions for Felix? No questions? Well, what we'll do, Felix, as I've just said when we lost you, we'll definitely share the slide and the information with everybody that wasn't able to make the call, as well as everybody here. So with all of the UKRET members, to really try to generate some interest. And I've also mentioned that as soon as you've got the full ethics approval, you know, the official invite and so on and so forth, we'll be able to share with everybody, and it would be great to see as many people there, because it would be a wonderful opportunity for an in-person event for those UKRET members who are able to make it. So
Exactly.
I think it'll be great. Thanks so much, Felix, for the opportunity. Thanks
Yeah.
for joining us.
Thank you all.
Okay, Tony.
Alison, sorry, I was a bit slow in your last presentation. Has that brochure been produced already?
It's on
Can you hear me?
it's on Canva. So Canva, does everyone know what Canva is? It's like an online design thing, so it's fairly easy to adapt and make changes.
To change. Okay, fine. Right. My immediate impression, that first picture you've got with the rear view of people, you can hardly see anyone from an ethnic diverse family there. So I think I was sensitive to a thing that Jim Assay once produced at the start, and it showed a black woman and a child, and a white woman and a child, and the first one that on the front page was the white one, and I said, right, let's have the black one on the front page and the next one on the next one. And it's subtle things like that, I think, that gets noticed by people.
I think I mean, I'm happy to look at that again. There are two.
Yeah.
I think one of the reasons why we like that image, it's that it does suggest a bit of diversity. I think there are.
Yeah, it's a great image, but it just, my immediate impression, maybe I can't see very well. I've got my glasses on it. Yeah. Anyway, just a thought.
I mean, certainly happy to look at that again and see what we can do. We have tried to keep, tried to be as representative as possible. It is a struggle. We do the same, it's really difficult, but it's important to be representative. So happy to have another look. And we can maybe have an alternative. I mean, it's kind of, really, really happy to be led by everyone's thoughts on that.
Yeah. My overarching experience with the genetic medicine services, that the real key to this is getting into trusted leaders and communities in some manner, in a really regular, routine way, to gradually get the messages across, to participate, not be suspicious of the past and all this sort of stuff. It's really very difficult. It's very frustrating because we're all trying to do it, and we don't seem to get very far with it.
Yeah, still, Gina said it takes a lot of work and it takes time. I think that's it does. It's by the nature of the problem not always that easy to find.
Yeah.
Thanks for the feedback, Tony. Well, thank you everybody for joining today. It's really nice to see so many of you on the call, and lots to share after the event. So look out for newsletters and information coming through, and enjoy the rest of your day and your week. Thanks very much.
Thanks.
Cheers. Bye.
Thank you.
Bye.
Bye.